So now we officially start our webinar. My name is Roman Sklotsky, and I represent the Foundation for Palliative Care Education, PASTE, and I'll moderate today's webinar. So thank you very much for connecting today. As you probably know, PASTE is the charitable foundation, a UK one, and it works with training professionals in palliative care in Eastern Europe, Central Asia, and in Caucasus region. And we do hope that today's webinar, that is opening our series of webinars, will be useful for you and that we'll be able to work productively together. So we already planned some upcoming webinars after this one. I'll share the agenda later and you'll be able to see the links to the upcoming webinars. As I said, today we offer our webinar in two languages, in English and Russian. We offer simultaneous translation. Our names are Anna Akmaeva and Anastasia Paliga. We are your interpreters today. And once again, I'd like to remind you that you can choose the track if you click the globe icon. You can use any language you prefer, either Russian or English, and you can also text your messages in the chat in both languages, English and Russian. So I'll switch to English to introduce our main speaker today, Dr.Piret Paal, and I'll give the floor to her just in a couple of minutes.
Thank you so much for finding time to tell us about the COST initiative and to share with us your expertise and your ideas. Dear colleagues, Dr. Piret Paal is PhD in philosophy. She is a behavioral scientist who has been working as a researcher and educator in palliative care since 2010. Currently, Dr. Paal leads the Institute for Palliative Care at the Paracelsus Medical University in Salzburg, Austria. And her research interests involve patient-centered care, palliative care education, and spiritual care. And she is the author and co-author of more than 25 peer-reviewed papers, numerous scientific proceedings, and book chapters. And she has been a member of European Association for Palliative Care since 2011. And she's an active member of this association, taking part in palliative care education reference group. Thank you, Dr. Paal. Я возвращаюсь обратно на русский язык и буду дальше говорить на этом языке. И сейчас...
So I'll switch back to Russian, and now I'll just would like to give you the agenda of today to give you the overview of the webinar. We hope that we'll be able to finish it in 1 hour, 50 minutes, 45 minutes. First, Dr. Paal will tell us about the COST initiative that was already announced in our mail with announcement of this webinar. And then we'd like to discuss the education in palliative care in Central Asia, in Eastern Europe, and in Caucasus countries. We see that we welcome participants from multiple other countries as well. Thank you very much, dear friends, for being with us today, but we'll still focus on the regions that I already mentioned: Central Asia, Eastern Europe, and Caucasus. Of course, we will have some time for questions and answers, and you can ask your questions by two ways. The first way for you is the chat, and the second way is at the bottom of your screen, you have reaction function. You can raise your hand, and then we'll see your raised hand, and we will unmute you, give you the mic. We will have time for all this. We'll try to be quite precise on time, and we will try to cover all the comments and all the questions. What's also important to mention is that today we are recording this webinar, and you'll get the overview of the webinar and all the materials after today. In addition to that, I'd like to say that we have our newsletter, monthly one. You can go to our website, paste.org.uk. There's a registration form that will allow you to subscribe to our newsletter, and you'll receive the emails in your email box. In addition to that, we have a closed chat for palliative care specialists from the countries that I've already named. To join the chat and to communicate with the colleagues in semi-formal way, you can fill in the Google form. You should see the link to this chat in our Zoom chat. Here it is, so please fill it in if you would like to join our group chat. So that's it from my side, and it's my great pleasure to give the floor to Dr. Piret, who will talk about the European cooperation in science and technology. It is COST. Abbreviation, and PASTE is also a part of that, and the main goal is to create the golden standard and to identify the qualitative benchmarks in the field of palliative care. And we think that this is a great opportunity for networking, for research, for development, etc. So, Dr. Paal, the floor is yours.
Thank you very much, and I am truly honored that so many people have come to this webinar, and obviously there is a great interest in enhancing palliative care education. And for example, there is great news from United States that just yesterday they took and accepted, the government accepted an important directive to enhance palliative care education and awareness, so to make it more accessible to healthcare workers. And I have been working in the European context, and in my former role, I will share now my presentation so that I will see. So that in my former role, I was working for WHO because our university in Salzburg is officially a WHO collaborating center with special focus on palliative care education. But then our university decided that we will have an institute for palliative care, which is the first one in Austria. And I have the honor to lead this kind of startup kind of initiative of our university. And that's why I just wanted to summarize the work that I have been doing since 2017 in Austria, but also in other countries. And I hope that you will get my slides also, that they will be put on for your disposal, because I have put also all the articles that have been published in this relation. I have listed them there so they can look them up. So we did an EAPC survey 2017-18, where we said that where we tried to understand that what every healthcare professional should know about palliative care, and we came up with these 4 things, which is to understand what is palliative care philosophy, to demonstrate symptom assessment and management competencies, to design care plans according to patients' and families' wishes, integrating multi-professional and interdisciplinary approaches, as well as to listen and self-reflect. And the one part is why I have this death here on my slide is that just like people in healthcare also sometimes are very afraid of death and fight against the death in their workplaces. And so to understand that death is not a failure, it might make a change in their practice. And on the other side, you see together everyone achieves more. This is learning to work together with 3 different professionals and understanding what they can provide so that the patients have less worries and less burden. Then we conducted a quantitative survey, and we focused on, I would call them less resourceful countries in the European region, which is 53 countries. And so what we saw from this survey was that there is limited political interest towards palliative care education, educational structures are limited, there is not too much curricula, although I would disagree with this statement. We have curriculum recommendations from EAPC, but also a true bottleneck these days is that even if you would have a law that says that every nurse and every physician and maybe even every social worker needs to learn about palliative care, we don't have actually educators for that. So there is a lack of human resource. and also the limitations of healthcare systems. So starting from lack of medication and ending up again with human resources, just not having enough people. Then we went further with that, and we did also quantitative interviews on site in 23 countries. I have to go back now. I have no idea how this goes. Maybe let me see. No, I cannot go back. But anyway, that was like a so important message. Let's go back. One second. I will go back. So somebody tells me how to go back. No idea. Let's try once more.
Dr. Paal, I think you have to leave the full screen mode and start anew, because right now it looks like you're in full screen mode.
Yeah. Okay. Escape. Yes. So we will start from this place again. It's good to have a little stop. I know I'm too fast anyway. And we were asking then, obviously you can understand that this sample is not representative. It was maximum convenience sample. So we identified 1, 2, 3 people from one country, mainly from the cities, obviously, where there is some palliative care movement going on, because we know that there are also regionally very big differences. But just from the surveys, and the paper also is mentioned down there, which was published in Palliative and Supportive Care in December last year, just one citation, what I think is so essential about palliative care. So that I believe all these principles, palliative care principles, are universally valid, because the most important in palliative care, which I believe gives the opportunity to respect every individual as a unique person. So having in mind this, giving the opportunity to every patient, to every person infected by one of these chronic diseases, to give the opportunity to tell us what the patients want and what not. If they don't want to know, we are not giving them more information. We give every patient the opportunity to have all the services of palliative care according to his or her needs. That's what palliative care is unique and is universally valid for everybody, because it gives this opportunity to respect everybody, either in the jungle, either in the Western society, to respect all these humans about what they want and what they don't. So and this is somehow something that leads me also in my work, that I see this kind of research and all these opportunities that come from United Kingdom in Europe, or maybe like Germany and Netherlands are also leading countries, and then our other countries just try to keep up, but they just don't have the resources, and so I think that we have to just spread the message that doing what is possible under the given circumstances is the best that we can do, if we listen to our patients and their caregivers, obviously, as well. And as the result of these interviews also, we did some content analysis, and we came up with a long list of things that are considered as barriers in palliative care. And it starts from access to essential medicine and ends with the question of how many hours should we teach? And is it about hours, or is it the quality of education? So sometimes lots of these curriculum recommendations focus very much on how many hours we want the professionals to learn palliative care. But I think that the focus should be actually on the quality of the teaching, and how do we, in the most efficient way, can teach people using the most efficient teaching methods also. And obviously, considering that you as the clinicians and also teachers, you just don't have time also to design good educational models. Then we came up with this cost action proposal last year in October, and quite many countries demonstrated interest to be part of this. So this is an action that everybody can join during the first year of this cost action. And so that's why I present it to you. And if you have the feeling that you would be interested to be part of this movement, I call it really a movement. It is more, as Roman already said, a networking and capacity building project. Then that we will explain you also how to do this. Now is the good time and opportunity to join. So what is this cost action about? It's solely focused on palliative care education and on palliative care education in primary healthcare. So not really like for palliative care specialists. And as Roman already said, it is about establishing or finding indicators to establish a gold standard for high quality education and training in palliative care in Europe, in pan-European context. And we have some ideas what these should be, but we are planning to do a consensus rounds to develop a tool which has a very crazy name. It's called Code Yeah. It should be kind of something that we really, when we say Code Yeah, we understand, okay, we will enable palliative care education move further within these 4 years that this action is going on. And then this tool will enable to measure, explore, and promote access to palliative care education. So lots of country level work has planned. And also for me personally is very important to see if this tool is culturally appropriate, and inclusive, and what are the particular skill grade mix and innovative strategies that are needed in country level or in your specific region. And also, obviously, ethically appropriate topics will be included in this tool as well. As I said, this tool is intended to use within countries across all disciplines, sectors. So we talk about midwives who maybe need some palliative care skills, or people who work in neonatology, and we also, that would be probably, that is too optimistic, but also that surgeons know like what palliative care is, and when it's time maybe to, instead of saying that, okay, lungs have metastases and bowel as well, do we cut the lungs as well? So maybe to pick a different road. We put it together, obviously, for the proposal reasons that we say that we have a group of people who are very fascinated about palliative care education. This group is called a FIRE group. And then we are looking for people, particularly younger people under 40 years, who would benefit from this collaboration, who would get their networks activated in European hemisphere, and who will become the torch carriers, and who will help us also to collect some country level data, and who will get publications out of this so that they can enhance their academic career as well. And obviously during these projects, the personal contacts are everything. These young people will have also an opportunity to participate in summer schools, which will be provided, different kind of summer schools. And they also can be nominated for an influencer award if they start in their country some kind of podcast, blogs that talks about palliative care, because we know that patients just know too little, or people know too little about palliative care. And so this kind of social media based or even news based initiatives are also very welcome and fit very well into this. And then we have Thunder Group. So we hope also globally to engage people. We have heard that Pallium Canada is interested in joining this project as a part of the Thunder Group to make noise. And also Pallium India has said that they would like to know about this project a little bit more. So I haven't heard from Australia, but I'm sure that there's somebody from Australia wants to join as well, and maybe even from Africa. So, but they can only be part of this project as observers. So So we have quite many objectives to this project. So we have to define the quality indicators. We are translating this tool into different languages. You can understand that there is a big need of vocabulary in local languages to speak about palliative care. So we want to embrace this. And this project enables also to develop palliative care vocabulary at your country level, to in your cultural context and in your political landscape. And so I think that it is very valuable. Then we will test this tool, and then we will analyze this data. So we will have country level data, and easily someone can do their PhD or medical doctor degree out of this. But we will also have the international publications then. Then we have capacity building objectives. And so I already mentioned, we will have the FIRE group mainly will be in a mentoring role. And so we will start this autumn already with media advocacy and policy training. So how to talk about palliative care, with whom to talk, and how to do something which is very important, advocacy. And we will try, this is a virtual event. That means that everybody really can join, also those who are not part of this, and we will find interesting people to talk about their experiences, how they have moved forward with palliative care and palliative care education in the region. Then we have a possibility to apply for grants, so people can do short-term missions into certain countries, and they can get one-to-one mentoring from someone from FIRE group, for example, and this can be funded via cost action. We have to plan it ahead, but generally it enables this kind of exchanges. And then we also have missions to showcase, as I said, teaching methods. There have been lots of European projects recently focusing on better improving teaching methods and innovative teaching methods. So if you define in your country that, I don't know, we don't know how to teach nurses team working skills, I might know someone, or in our group, someone might know people who exactly have exercises designed for team working. And so yes, this is an opportunity. And then we have also a leadership education program, which is will take place in a summer school mode. We don't know yet when exactly this is, but we will know it then starting from the September 21st. Then also we have ethics program in palliative care, which is also a summer school. People can apply for grants to travel there and stay there and be part of this summer school. And then obviously there is the scientific and public dissemination for advocacy and best palliative care. So there's a theory that you have to have 3 streams. One is the problem, then you have to find for the potential solution, and then the stream that leads to change only happens via political and public opinion. So we have to kind of use this project to influence politicians who we can involve in this action, as well as change the public opinion about palliative care. And then at the end, what this network is, actually the cost action is for that purposes, that if you think that later you want to do a more scientific proposal for research purposes, for clinical studies, then you already have got to know lots of people, and you can form this kind of smaller groups to apply for Horizon funding or ERA funding that is then more for a different kind of research. So this have also the action roadmap, and we at some point when we submitted this, these were the countries who participated in the submission phase. But as I said, it is still open during the first 2 years. Everybody can join. You just have to send an application via cost portal. We will show you where that is. And also some of these countries have not really officially now said that we are that. So if you see your country there, maybe you check with me who is, or you can see everything at the cost site also, or write me an email. to contact. So we will have 6 working groups. I said we have this kind of like fire, thunder, and torch groups. We had this because we also have emoticons for that, so we can converse with viewing nice pictures also. But then we have 6 working groups, and if you sign up, please pick 1 or 2 working groups that you find interesting. There are this gold standard working group where we define the standards. Then there is a culture, language, diversity group that has to do lots of with translation, the materials, preparing also glossary, and having then something really very important for your country, so that you can do this kind of assessment of palliative care education quality again and again, and see where are the problems that you need to address, and then the other groups are there to help you with finding the solutions. And then we have research and coordination methods, impact analysis group. We have capacity and leadership and ethics group, which is mainly focused on organizing the summer schools, global policy and advocacy. Again, very interesting group, probably needs to engage a lot with health ministries, for example, and other governmental bodies, and also project management group. There are opportunities. We have a time frame. We will have 48 months to make noise and make a change. And I am not repeating here everything I know, but I think I would like to give you time for questions. And you can contact me. Roman is also very well informed about this project already, and I would be really delighted if some of you decide that this is interesting, I want to be part of it, and now, precisely now is a good time to apply, because we want different countries to be part of it, and I think it is, I really truly believe it's a good chance, in particularly for younger scholars, but also for those who maybe don't have very strong networks yet, to get to know people. So everything is online, all the technical things that I told you are publicly available in the memorandum of understanding. You can read it there. It's very below at the page there. You can see who are currently the members of management committee. They will be democratically selected, everybody. Then you, so these are the people who have officially joined, and we have then also a lot of people, many people who have just wrote and applied. We have to still talk with management committee, then who can join and who not. So we of course want people who say that I want to also contribute to this this project. So not only those that who say it's nice to travel and I will travel everywhere. And so yes, thank you very much for listening, and I am now open for your questions, and if, I know it's a little bit confusing. I had to take lots of time to understand myself also what is it about, but I think that now finally I'm getting a grasp of it. Thank you.
Спасибо большое, доктор Пааль.
Thank you very much, Dr. Paal. It is a very big scale initiative, which is for 4 years, which is quite a big horizon of planning. And it is a very big scale initiative which unites many countries. And it is quite ambitious. So thank you very much for presenting and for being such a leader that promotes this very important topic. Just in a second, we'll get to questions from our participants. And for the moment, I would like to sum up, to generalize. Dr. Paal, who can apply for taking part in this initiative, and which steps does a person need to take to join this initiative?
As you already saw, first of all, the first place where to start, first of all, you have to do some self-assessment. And I just have to say that COST suggests that people who have PhD or have a doctoral degree can join this initiative, so that it really is something to enhance their careers. So it might be problematic if you work in a hospice and you're a nurse and you are not in a PhD program, for example. So I really don't know what's the solution. And for that, there are national cost agencies that can answer those questions, because the application system runs on two parallel roads. So one is the EU cost, which is from the European Union, and all European countries are eligible to apply and participate in this, except Hungary. So if you are from Hungary, currently European Council has said that Hungarians are not welcome in those projects. I have no idea. And then you have to go to this Costeo page and fill out the CV, put all the information about you there, and then you have to click and say, I want to join this project. So you send an application, and I will get this application, and I will get your email. Those applications will be looked at during the management committee meeting, which will be on the 21st of September, or during one meeting that is a little bit later, because it may be that we cannot look through all the applications at this time point. And then what is very important is that you have to also do self-assessment in terms of that, do you have time to contribute? Because sometimes you have to do some things. It's not only that you travel to meetings, but it's also that you are expected to inform people in your country about this action. So you have to take an active, you have the ability, I don't say you have to take the active role, but you have the possibility to take a very active role at country level as well as internationally, and to make a change, become a change agent, basically. And therefore, it is now a good time, if you have signed up at the EU portal, then you will get an email from assuring that you have done the application, and then you also immediately get an information where it says that you have to contact your national agency, and then you contact your national agency, and they might want, for example, that your university or the institution where you work also agrees that you are part of this. So usually deans of the university are very busy. They also say, like, how much money do you get? It is not like this that you can pay any salaries. It is really grants, and travel expenses will be covered based on a very strict EU format, but people, particularly who come from less resourceful countries, have some little bit more benefits also. So they might get like a grant payment 50% before the event, so that they can buy tickets and stuff like that. But it's a little bit too complex now to explain everything here. And so it is also expected that at least 2 institutions from one country join. And it is, of course, to secure that, for example, if you are very busy and don't have time, that someone else from the university, other university maybe, will take over and cover for you for this time. And why it is important to look also for younger people, again, I say it's under 40, that they can take this entire cost, and action comes with fantastic job titles. And it was a time where job title was everything, so that they can put in their CVs that they have been working group leaders, or they are even like country leads, management committee members. And as you can see, this kind of positions then can later be very helpful if they apply, for example, for a assistant professor place or something like that. So yeah, so it is again, I think, project for palliative care champions, although I strongly think that the championship time should be over, and we need to demand that we have official roles and positions also in healthcare landscape, but maybe this project also can change it a little bit. Yeah.
Спасибо, Доктор Пааль, очень интересное замечание.
Thank you very much, Dr. Paal. Very interesting idea about championship. Very interesting idea. Thank you for your explanation. And now we are opening a little Q&A session. I'm sure that you do have those questions. You can do it in two ways. You can either raise your hand through reactions in Zoom. You can do it in English or Russian as you wish, or you can ask your question in the chat. And by the way, we have a question in the chat already. So some clarification is needed. What if a participant is not from the European Union?
That doesn't matter. We talk about pan-European room. That means that all the 53, I think is the official number of countries, can join the action. So it's not an EU project, although it's funded, but it really especially focuses on Central Asian countries, Eastern European countries. It's even like one of the evaluation criteria that you always have 50% of countries from Eastern Europe and Central Asia as part of this project, and not only Western European countries or only EU countries.
Спасибо большое. У нас есть еще один вопрос.
Thank you very much. We have another question in the chat.
Рауан. Здравствуйте, спасибо большое. Очень
Thank you very much. Hello. Very informative. Is there a list of those 53 countries?
What kind of countries are meant now here?
Эти 53 страны, которые...
The 53 countries.
If you look at the WHO region, Europe, Euro region, then you will see those countries. Yes, it's based on like the WHO is divided into 6 regions, and there is this WHO Euro region, and then there you see with some exceptions, as I mentioned already, Hungary, but basically because that's a new directive from European Council, it just came now in July, and maybe there are some former this kind of things, but basically it is open to all countries that are situated in WHO Euro region.
Спасибо большое. Спасибо большое.
Thank you very much. Colleagues, any more questions to Dr. Paal? You can raise your hands, you can write your questions in the chat as you wish. If you have questions, of course. Looks like there are no more questions, but we'll be happy to take them if you have them later. When you go on the website of this initiative, when you look at its thorough description, and then as paced, we'll be able to accumulate all your questions and to ask Dr. Paal those questions. Or you can actually write to her directly, I guess, as you wish. We'll be happy to take those questions if you have them while you are starting this initiative. But we have another question from Morale. Can you specify criteria? Morale, actually, we are speaking about criteria, but it's not very clear. You can maybe ask your question verbally to clarify. We will now give you the right to switch on your sound if you wish.
Марал, если вам удобно, то мы включили вам микрофон.
So, Maral, your mic is on. We've unmuted you. So, what? Okay, so Maral will specify the question in the chat. So, what are the criteria?
Здравствуйте.
Right, now we can hear Maral. Good afternoon. I'm sorry. Well, I'm from Kyrgyzstan. I wanted to specify the criteria, like what kind of university. Maybe there are some criteria for professionals or professors who worked in the palliative care.
Usually, I think it's very good if you represent a university. So it's mainly meant for higher education institutes, but your personal criteria, you will notice when you start to fill out this, you also have to write a little motivational letter, and then it depends how many people sign up from your country. So if you have, like, I don't know, from Kazakhstan, 20 people sign up for this cost action, and obviously the Kazakhstan local agency will look who will be the most competent person to be part of the management committee. And if there is just like I don't know, so you have to write also a little bit that you have experience in teaching and why you want to be part of this action, and if you it might be difficult for some people also to the working language of this group will be English, obviously, so you have to also think that do you have the linguistic capacity to participate. But we have also this collaboration with BASED, and they have also agreed to be part of this as an NGO and help also with this linguistic challenge, which we always have in Europe if we work together. So I hope that it will not be a barrier. But yes, you will see if you sign up. It is good if you are already like a higher level somehow. As I said, it's a problem with the masters, master's levels or PhD. But if you are a doctor already, then you can easily join this. And so these are the criteria. Always at this point of time, it's good to contact your national agency. I am also doing this for the first time. So as I said, I had to learn a lot to understand how this works, but national agencies get paid actually to explain us how this works. So you can use them as a vocal point to ask about the criteria as well. But I think that it's important just to be, to sign up, and we will, from the behalf of the management committee, will try to accommodate as many countries as possible. And we have to be also, we have already seen that some criteria that there, for example, if you compare palliative care education, even in my own country, in Austria, with the one in Romania, then Romania, even though Eastern European country, is much more advanced than Austria. So this criteria that the cost has given doesn't apply really. So we have to, if there is a problem, there is a solution.
Спасибо, доктор Пааль. И, коллеги, у нас в чате появился список вот этих стран, 53.
Thank you, Dr. Paal. And dear colleagues, in our chat now, we've listed all the 53 countries Dr. Paal mentioned. So you can take a look now, or you can easily find the information on the internet. And to find contacts of your national agency, you need to go to cost.eu. And well, very simple to find your national agency. All the contacts are there and you can reach them easily. Dear colleagues, are there any other questions to Dr. Paal? Yes, please. We can hear you. If we don't have any questions for now, let's continue. Dr. Paal, thank you very much. And now we'll continue with our second part. In this second part, we'd like to talk about the education in palliative care in your countries. I hope that it will be joint discussion, and I hope that it will be enriching for everybody. First, I'd like actually to show you the results of the voting or survey results of the survey that we conducted just a couple of days ago in our chat. I'd like to remind you that we have a closed group chat. You can sign up for that via our Google form. So the first question, where did you study palliative care, organization and provision? So 40% of people learned it through work experience, quite a lot. Also, about 40 at the professional development courses and about 20% in universities. And other option accounted for 30%. We'll mention what it actually is a bit later. The second question that we asked in our group survey, how would you assess the current state of education in palliative care in your country? Excellent, 0. That was acceptable. But 50% of all the respondents said that, well, only available for specific topics and areas, courses only available. And also, there is a choice of educational programs with certificate attainment, 21%. And almost 29% said that like this, education is almost non-existent. That was the second question. Thank you for answering this. And the third question, do you engage in teaching in the field of palliative care? We asked in our group chat. 58% said that yes, I train colleagues at the workplace. And this is actually quite in correlation with our first question, according to answers to which about 40% learned palliative care at their workplace. And if we could go back to the third question, where we'll see all the responses. So 58% said that they train colleagues at the workplace, 16% said that they teach at the university, and also 16% said that they train at the professional development courses. So in total, that makes 32%. That's quite something, I think. So dear colleagues, those are quite interesting results for us. And now I'd like to talk to you in an interactive format. This is the second part of our webinar. And I would like to ask participants from different countries to comment. For example, where did you study palliative care? What is the state of education in palliative care in your country now? And do you train other professionals in this field? So if somebody could share this to voice your answer, or maybe you could just share your experience in the chat, that would be great. So first question, where did you learn palliative care? We have a very informal professional community. So Maral, please, the floor is yours. I see your raised hand. Please unmute yourself. Yes, hello. So I'm from Kyrgyzstan. My primary education, my primary certificate is from the professional doctor's development course in palliative care. And after that, we just got some trainings from some experts. For example, experts from Mongolia came to us. Professor Abdolia came to us to train us. Also, professors from the UK came to Kyrgyzstan to train us. So basically, that was like short courses, 5-day, 3-day, 2-week courses. And now, when we got trained, we also teach ourselves. In the past, we did have a project in palliative care. It lasted for about 8 years. We trained how to give palliative care at home, and we first were trained, but then we were disseminating this knowledge across our country. Mostly, we were talking about pain management. Thank you very much, Maral. That's very nice that you share this experience further. Sorry, yes? So, as of now, in Kyrgyzstan, we only have short courses in palliative care. Short, I mean 1 week, 2-week courses. My colleague trains our professional at our state medical academy. But when it comes to state universities, we don't have any departments that train in this field. We don't have any chairs, any departments, basically nothing. We don't have this established. Thank you very much, Maral. We will talk about the problems that are there. Thank you very much for sharing your experience. We have 2 comments in our chat, so I'd also like to read them. So we have a colleague from Russia and a colleague from Kazakhstan. So a colleague from Russia says that she's a doctor in palliative care in Moscow. It was quite an accident that she got in palliative care. She's a neurologist, and in 2019, she got an internship in Oxford. And as of now, she works in the field of palliative care, and she also teaches in the field of neurological nosologies in palliative care. And our second comment, I'm from Kazakhstan. I actually got trained within a master's degree in palliative care. And I'm very thankful to Tatiana Ostritsova, who's actually probably present in our webinar. And currently, I'm training residents in palliative care. It's a very short course, 2-week course. It's very, very short. Yes, indeed, colleagues, that's absolutely true. It is very short. So, colleagues, we have 2 more hands raised. Let's now give the floor to Anya Gorchikova and Pavel Bondarevich. So, colleagues, could you also please share your experience in education and palliative care? Yes, hello. Can you hear me? Yes, we can hear you. So, good afternoon. Very shortly, I work in the children's palliative care. I was trained abroad in the US. I was trained in the UK. Currently, in our country, we have postgraduate courses. Unfortunately, the number of courses is decreasing, not increasing. This is postgraduate courses once again. In our university, we don't have any training in palliative care for either children or adults, but still we have now the new department opening palliative care in France. And where are you from? I'm from Belarus. Okay, thank you very much for sharing this. And let's give the floor to Pavel Bondarevich, and then we'll continue with the next question. So Pavel, the floor is yours. Yes, good afternoon, dear colleagues. My name is Pavel. I'm also from Belarus. We are colleagues with Anna, the previous speaker. So we work in a hospital in the palliative department for adults. So unfortunately, we don't have any good training in palliative care yet, and we'll be very happy to cooperate to establish this in Belarus. We'd also be very happy to cooperate with you from PASTE side. So, dear colleagues, now let's go to our final block. It will take us about 25-30 minutes. So it would be very nice for us as PASTE and for Dr. Paal to understand what are the problems in the field of palliative care education. So just let's go country by country. Well, I guess we have today Armenia, Kazakhstan, Ukraine, Belarus, Georgia, Kyrgyzstan. So those are the countries that we have today, definitely. And now we will show you a board. We will note all the countries that are represented today. So let's note Armenia, Kazakhstan, Ukraine, Belarus, Kyrgyzstan. And so, dear colleagues, this is voluntary task, but let us try to identify 3 most critical problems in the field of palliative care education in your countries. So those are the obstacles that prevent your countries from developing the palliative care. What are the key issues? For example, maybe there are no standards, protocols in palliative care. There are no standards for training. I mean, there is no curricula. Maybe there is no structure of how to train this. Maybe something else. So let's try to analyze all the countries that are represented today, and that's how we can draw a problem field in the regions where PASTE is represented. So Maral, let's start with Kyrgyzstan. What are the main problems in the education in palliative care in your country, in Kyrgyzstan? Well, we don't have any standards. We have clinical protocols, we have clinical guidelines, but we don't have any training standards. So we don't have educational standards. That's the first one. Second one is that we don't have any departments at the universities. So that means that we don't have professors who could train. If we had departments or faculties, then we would have more staff. We only have 2 people who can actually give training in palliative care. It's me and my colleague. Another problem is that the state doesn't really support the area of palliative care. If that was financed better, then probably there'd be more interest. But the palliative care is not very well developing now in Kyrgyzstan, both for children and adults. So it's quite a problem. There are a lot of patients, but there are not so many people who'd like to work and train. Okay, Maral, thanks a lot. Actually, you stated even more problems that we initially asked for. That's good and bad at the same time, but it's good that we have an understanding of how difficult it is to develop the palliative care in Kyrgyzstan, and it will be quite difficult to take it to the next level, but it's very good to at least be aware of these problems. So we also had colleagues from Belarus. So Anna, maybe you could speak about education in palliative care in Belarus. Anna Gorchikova, could you please comment? Yes, I'm switching my sound. Well, I would like to join the words of my colleague from Kyrgyzstan. We don't have any standards, but I'd like maybe to deepen the problem a little bit. We don't have palliative doctors. We don't have such a profession, so to say, such a specialty. Even if we have like a map for this, who would do this? Neurologists, but they should be the palliative neurologists. The presentation that we heard today was amazing, and the most good idea is that we should have a philosophy of palliative care, but unfortunately we don't have it, and we should change our attitude to this philosophy. I don't think that we can change anything until we change the philosophy. Okay, so speaker, so just those people that take care of palliative care, those are the people that are forced to do this. That's basically it. Okay, thank you very much, Anna. So we'll copy these problems, and I think my colleague Pavel could join me. Pavel works with adults. Pavel, do you have any comment? Well, I don't have any other comments. I agree, of course, with everything that was said. The problem is that we don't really have a common understanding of common philosophy, why we need palliative care. What is the economic profit from that? And there is no so much support coming from the decision makers in our country. Okay, dear colleagues, thanks a lot. So we also have colleagues from Kazakhstan. Maybe you would like to comment, because I heard that it's a bit different from Belarus and Kyrgyzstan.
Kazakhstan? All right, let's try to ask colleagues from Georgia. I think that they are there as well. From Moldova. Yes, somebody has raised their hand. Gulnara from Kazakhstan. Hello. Hello, Gulnara. Over to you. I just didn't know how to switch on my microphone. Yes, but you managed that. That's great. I'm joining my colleagues. Anna from Belarus and Maral from Kyrgyzstan. And actually, I want to repeat the same things. Same thing here. We don't have the specialty, but we have the so-called specialization. Education takes the form of postgraduate studies, even though there are obligatory hours that should be dedicated to palliative care, both in universities and in colleges. I think that around sufficient hours, it's not only my opinion, it's that of everyone. And everyone teaches what they deem required in their universities. There is no one single standard. Right, it's a question of standards. Yes, that's a question of standards. Standards should be the same. And standards must include everything. The standard itself is to communicate the philosophy. It must be included in it. initially. We don't have the chair yet either, palliative care chair. And the same problem, there is no one to teach. There are some individuals, enthusiasts, champions of palliative care that teach. They teach very well. But of course, if you want to train 6,500 specialists that our country needs, you cannot train all of them with such a small group of people. Thank you very much, Gulnara. Looks like palliative care must have its philosophy. Philosophy is the basis of everything. If there's no philosophy, then it is very difficult to develop something further. Right. You know, there should be a national strategy that needs to be stated somewhere, written down somewhere, right? Philosophy that is converted, that is put into national strategy, and then it gets to the level of national standards. Thank you very much, Gulnara. And Alexander Karapetyan has raised his hand as well. Over to you. Where are you from? Alexandra. Yes, hello, I'm from Armenia. Hello. I'm from Yerevan. I'm working in Yerevan State Medical University. I don't have much to add. Here the situation is pretty much similar. In Armenia, we have a subspecialty. It is like the secondary specialization for nurses and for doctors as well. In our university, we have interdisciplinary group that retrains our specialists. We don't have a dedicated chair for the moment. There aren't obligatory hours either. We only have mandatory hours in college. However, as for university, we don't have mandatory hours dedicated to palliative care. That is our situation in brief. Pretty much like in other countries. That's true, there are many similarities. Thank you very much, Alexandra. Work with our interdisciplinary group. It was established in 2016, and this specialty appeared in 2016. Specialization of 2 weeks, but you will all agree that 2 weeks is too little to acquire that secondary specialty. Of course, that's too little. Thank you very much, Alexander. Big hello to Armenia, to everyone. Colleagues, there are other countries as well. We don't know for sure what countries they are, but if we have Georgia, Moldova, Ukraine, then you're very welcome. You can also say something, agree or disagree, add. Over to the next participant. Introduce yourself, please. We can't hear you. Firefly World, please switch on your sound. Hello. Good afternoon. My name is Irakli. I'm working in pediatric hospice in Tbilisi. We have pretty much the same problems. Studying is done in a very superficial way. There is no specialization acquired. And there is also a problem at the legislation level. It's very important to have more outreach to understand how crucial palliative care is and to teach it at universities. And I can also say that there is another problem, which is lack of nurses. shortage of nurses that would like to get trained in this specialty. The main reason is that many people living for other countries because their salaries are higher there, and they actually go there to take private care of children and of elderly people. Thank you very much for your comment. It adds to the overall picture of what is happening in other countries. Thank you for this very important comment about nurses and low salaries. That reflects the overall situation. As a consequence of absence of philosophy and of strategy in this area. Colleagues from other countries, those who haven't yet spoken, do you need to share something? We received a question in the chat. There is Moldova. If somebody from Moldova can write something or say something, that will be great. Switch on your microphone. Gulnara hasn't spoken yet. Gulnara has. However, Natalia Karafizi has not spoken yet. I'm sorry if I mispronounce your family names. Over to you, Natalia. Good afternoon. Can you hear me? Yes, very well. Very happy to hear all of you. I think that our problems are the same, irrespective of where you live, which region you live in, and which language you speak. Well, we are all speaking Russian here, but the problems are the same, and they don't get solved over time at the speed that we would love to see. As for our country, and where are you from, by the way? I'm from Moldova. I'm from Chisinau. I represent the organization which is called Hospice Angeles Moldova, which is the biggest non-governmental organization that provides a palliative care, both at home for adults and for children, and in inpatient facilities. We have an inpatient facility for children. I totally agree that we need to have philosophy of teaching. I mean, yes, we don't have it. We don't have it anywhere in the format we would like to have. And if there is no the notion of standards of teaching, then I guess we need to introduce them, standards of teaching. We're all speaking about medical standards. A doctor that has certain specialization in palliative care has the right to work, is eligible to work in palliative care. Same with teaching. If a doctor, a surgeon, is a surgeon or a neuropathologist, it is good. But if they were not specialized in palliative care, then they cannot teach that either. The same is true about nurses that would teach that. Just like in all other countries, we have a problem of financial fraud and attrition of personnel. Not everyone knows and is aware of what palliative care is. Unfortunately, people that we train don't always stay for long in palliative care because initially they think that it is something different. They don't have the understanding of what palliative care is, even when there are people that actually got trained in medicine, right? That have medical degree in medicine, right? Even those who already come with some minimum knowledge of palliative care. Despite all of that, we have two courses, mandatory courses for students of medical university, starting with year 5. They are taught a palliative care course or a cycle. And then we have one college for nurses, where palliative care is also taught. However, neither here nor there is there a palliative care chair. So usually it is taught by chair of family medicine or by oncology chair. And they are quite short courses. Unfortunately, they are only based on theory. And again, this theory is not taught by specialists of palliative care. As for us, specialists that were trained that have been working in palliative care for many years, it doesn't mean that people don't come to us with their questions, but you always face that problem. You either work with palliative patients or you teach. It's one or the other, because we are so not numerous. There are so few of us that you cannot physically work here and there. It's not possible in terms of your work schedule. And that is why education system suffers from that. Students or nurses in medical colleges, they cannot listen to specialists that are working in palliative care directly. Thank you very much, Natalia. We have a very similar comment from Gulnara in the chat. Gulnara from Kazakhstan. She writes that usually teachers don't have practice, and it is difficult for doctors to pass on knowledge to students. So there is this gap between and academic environment, just like what you have described in Moldova. Thank you very much, Natalia. Hello to Moldova. Gulnara, do you have another comment to make? I see your raised hand. Or is it your old raised hand, and have you already said everything you wanted? Or would you like to add something? It is the hand that I raised some time ago. All right, colleagues, are there any other countries that would like to add some information? We will structure all of it. Later, we will listen to this webinar once again. We will make it digestible, so to speak. We will share all the information with you. So if you want your country to be present on this map as well, on this problem map as well, then you have the time and the possibility to say something, or has everyone spoken? May I add a couple of words? We have Roland Zhimbaev in the chat. But Roland, maybe you can write in the chat which country you represent, and we will add your comments. Kazakhstan. Thank you very much, Rowan. We have already added your comment on the map. Thank you very much. Colleagues, we are almost finishing, but I would like to raise another topic. The fundamental problems you are speaking of, they are very complex. It is philosophy, strategy, standards, implementation of them. It is a big, long way which is to be covered. And the difficulties that you have now, of course, it is evident that they take a lot of time, energy, and resources, and you need to overcome all those problems. Initially, we wanted to discuss one simple one simple solution for each country. But looks like everyone has pretty much the same problems. So just say one idea, one simple, easy solution that could advance the sphere of palliative care at least a little bit in your country. What could it be? Something that can be done tomorrow with little effort, or is it something utopic and do miracles not exist? However, if you have a solution in your mind, we'll be happy if you can share it. What can be done to improve the situation tomorrow, at least by 1 millimeter, you know? You can say it verbally, colleagues. Sorry? Maybe elaborate a model standard, to develop a model standard, and maybe adapt it to different countries. It won't be very different in different countries. And try to promote it at the level of Ministry of Health and Ministry of Education in those countries. I guess everything works differently in different countries. But when we train doctors, we have a Department of Science and Human Resources as part of Ministry of Healthcare. I think that we could try develop this common standard at the level of that ministry, to develop it and to approve it for higher education institutions and for colleges. You are speaking about standard of education in palliative care, or are you speaking generally about... No, I'm only speaking about standards of education, which disciplines they are, how many hours, and so on. Looks like not a very simple solution, Gulnara, but thank you for your comment anyway. Maybe We cannot have any easy solutions there. Colleagues, does anyone else want to say something? Maybe Anna Gorchikova from Belarus.
Если комментариев нет, коллеги, это тоже
If you don't
нормально.
have colleagues, it's fine as well, colleagues.
Может быть, провести вебинар для тех,
Maybe hold a webinar for those who could develop such a standard in their countries. Well, not a webinar, but a cycle, a whole series of webinars. May I add something as well? Natalia Karafidze from Moldova. Maybe it will sound utopic. I don't know palliative community in your countries. What we face in our country. Sometimes suppliers, providers of palliative care, they think that the ministry knows better, that they will come and do something in our place. You are speaking about something that could be done tomorrow. Well, first of all, we can get aware of what you want in your specific country, what you want to do, and make a kind of a draft. If we speak about a specialization, right? Find someone, which department, I don't know, the structure of your Ministry of Healthcare or Ministry of Education. So which department is involved in it, where it all comes from, and who you need to address, but to provide something specific, some arguments. Now, you're speaking about structure of educational program. Romanian and Moldovan languages are pretty much the same, and we took a lot from Romanian ministry. I don't remember what it is called correctly in Russian and in English, but they are standards of educational curriculum, be it for universities or for medical colleges. The minimum that we have, we can already use it. And after the webinar, I will try to send you emails with all those data. Thank you very much, Natalia. Yes, to base ourselves on something. Thank you very much, Natalia. 2 memes have already been created during this webinar. The first one is, well, something untranslatable, shove something away, you know. And the second one is something like hitting the ministry. Well, that was kind of direct translation. Not hitting them, but we should not use force. We should always, you know, be cooperative and collaborative. Yes, that is an important remark. Thank you. Colleagues, who else would like to say something? Piret is leaving some links in the chat. I will show the screen. Yes, and meanwhile, I will read Pavel Bondarevich's comment from Belarus. Popularization of palliative care in colleges and universities to attract young people who are full of initiative to palliative care. Right? We will put it in our board as well, and it can also be one of the solutions. Maybe not the easiest, but it is one of possible suggestions. Great.
За такую продуктивную работу. По сути, мы провели такой
Dear colleagues, thank you very much for this productive work. So we've conducted a brainstorming over a very short period of time. We identified problems and problem areas, and we also tried to maybe come up with some low-hanging fruits or solutions, quick solutions of how can we change the situation. Dr. Paal, I have a question to you. Obviously, the picture is very complex and difficult, and what we are doing within COST initiative is actually the ways to address the problems. So what do you think in general about the picture that we've drawn today?
Yes, thank you very much for contributing, and it was really fascinating to see that, because I posted in the chat a study that, and in the beginning of my presentation I also mentioned these interviews that we conducted, and some of you actually contributed to this study as well. This was done 2018. So we visited the countries and did the interviews, and my interest was that if COVID has changed things for better or for worse, because sometimes also crisis is a good place for development, and I think it has been both, as we can see. But I have to always also so maybe I just pick 3 things. So, but first I advertised in the chat 2 projects that one has been finished. That is really the Romanian project led by Daniela Moșoiu. And this has led to a curriculum recommendation from EECA for medical undergraduate students. And she indeed in Romania applied this in 4 universities, and we asked the teachers so that how it was done also, and we have published also the results. So how they managed to put this palliative care into their curriculum, and what were the difficulties, because we trained them also in teaching methods, you know, so that they would be better teachers themselves. And they said that it was very easy to teach symptom management, but when it was about, for example, grief management or spiritual care, they were incompetent, and they kind of skipped those topics. And I think sometimes those are also very essential components of palliative care. Then I posted another project which is for nurses, and this project finishes in August. Everything is for free. All the teaching methods are for free. Please go and have a look. They're translated partially into German. They're all in English and in Finnish and in Belgium language, I think. So there are lots of materials in the virtual showroom, and there is even an internet where you can connect with people who teach palliative care to nurses. So lots of materials there, lots of things for ethical deliberation, teaching teamwork and stuff like that, everything out there. So don't start doing it by yourself from zero. Ask people and connect with people. And then these are like 2 advertisements. And then the problems that you mentioned are some partially in our paper that I posted as well mentioned. And one serious issue, I think we really need this kind of quality standards. Otherwise, I wouldn't have started with this cost project either. And so that we can really put our finger on the problem at the country level and say that, okay, ask others that what solutions or what could work here. And so if you are, as one of my Estonian colleagues once told me, that if you are starting later, you can learn from the mistakes of others. So you actually are in a power position that you can avoid making some mistakes that others did, just, you know, learning by doing. But also in Austria, we have exactly the same problem as you said. Do I care for patients, or do I develop educational models for my students? And I think that, and that's why I said that it is time to stop this championship as well, because we as athletes in palliative care field, we get tired at some point. And we need to train the new people who come and take it over from us. Some of us have worked on this field 30 years, 35 years, we retire, and we have to look, is there someone still who takes it over? So this kind of investing in our legacy, and this can be done during exactly using this kind of, I now feel like that I advertise my project, but I tried to show you on these 4 slides that I have really invested lots of time and effort and really tried to understand what the problems are. And I wouldn't have written this cross proposal if I wouldn't have believed that it can be a solution. And the solution is to make noise, use the words that people understand, because we heard also, some of you said, we talk with colleagues, but they expect something different, or, you know, they understand that it's only for the final hours of life. Yes. And then you mentioned neurologists. I have groups of neurologists from United States and from India who are very interested in neuropalliative care, but in Europe, the majority of palliative care specialists come from oncology, obviously. So we have to keep on plowing the field, but there are no one solution fits all. I think that honestly, as a self-reflection, I think that the United Kingdom model can be even colonialistic somehow, that because people have different values in different countries, and we have to integrate those in our palliative care models, country level palliative models. And I just tell you one example, because otherwise it's an empty statement. For example, dying with dignity. It can be a very, very different thing in very different countries. It is totally context dependent what it means to die with dignity. But if we operate that palliative care enables to die with dignity without knowing what it means in our country, then we actually fail our patients. So if we have a model of this, well, and again, for many countries, I ask, do our people live with dignity? You know, so I think that palliative care philosophy can also change in the general medicine, this idea that we are just not focusing on this final 18 days of life, which is the average access to palliative care services worldwide, that we also see how our people live when they are diagnosed with a chronic disease, and so that they can live at their fullest, what Dame Cecil Saunders actually put in her statement. Yeah, thank you for listening, and it was very interesting to listen to your experiences, and let's keep conversing and networking. I think we can learn from each other a lot.
Спасибо, доктор Пааль. Спасибо большое за комментарий. Мне кажется, очень сильным тезис про то, что понять...
Thank you, Dr. Paal. Thank you for this commentary or comment. Of course, you're absolutely right that dying with dignity differs from country to country. Well, we would like to see this concept to be universal. This concept of dignity to be universal. Maybe this could be a strong position of the humanity. This is a philosophical question that leads us to the dimension of both philosophy and palliative care. That was a very valuable comment. Thank you for this, and thank you for all the other comments, Dr. Paal. That's very valuable. So, dear colleagues, we have 10 more minutes actually in our webinar. Maybe if you would like to mention some questions that we didn't touch upon today, you could voice them. What worries you? What concerns you in the field of palliative care? Maybe we missed something today. If you have any comments, we still have about 10 minutes, and we have this time and we can use it to discuss this. And while you're thinking, I'd like to announce our upcoming webinars. The first one on the 20th of July, 8 a.m. Central European Time. We will learn from our colleagues from Kazakhstan. They will talk about launching a respiratory support and palliative care competence center within a non-profit organization. It took our colleagues 1 year to establish this, so that will be quite an interesting webinar that you'll be listened to, and you'll also be able to ask your questions. And on the 3rd of August at 1 p.m. Central European Time, we'll have a webinar on volunteering in non-medical palliative care. We'll talk about how to organize volunteering work in this field, how volunteers can change the situation. And so these are the webinars that are upcoming, and you'll quite soon will see the forms, the registration forms for these webinars in our group chat. But once again, we'd like to remind you of these webinars today, and we'll continue reminding you of these webinars in our group chat. So, dear colleagues, have we missed any questions today that you'd like to discuss in the future, that we should focus on maybe in the future? I'd like to offer the following comment. This is Maral. It would be great to actually involve spiritual professionals, maybe some psychologists in this discussion, because it's also quite a problem. In Kyrgyzstan, we don't have palliative psychologists. We have very few. We don't have spiritual professionals that work in the field of palliative care. That's quite a problem for us. And so as to the questions, I'd like just to share my experience. We have family medicine training, and we have short courses. We trained young doctors in the regions. within this. It gave us very good results because when young professionals, doctors are trained, they become more open-minded. They get rid of some such concepts as xenophobia or anything else. And so that would be nice to have departments at the universities. But the question is how to organize those departments or chairs at the universities. Well, Maral, thank you very much for this question. Actually, the topic of spiritual support is the field of competence of Dr. Paal, and I think we'll think about how we can cover it later within our webinars. And I can't help but agreeing with you when you talk about the young professionals education. Of course, the younger the person, the easier it is for the professional to get trained and to get rid of some fears, fears that could be associated with the doctor's work. Thanks a lot for this, Maral. Dear colleagues, are there any other comments from your side that you'd like to share? If there are none, then I'd like to probably step by step conclude our webinar today. I have just a couple of announcements to make before we finish. First, I'd like to thank Dr. Paal for your contribution. Thank you for being with us today. Thank you for sharing about this initiative, COST initiative. Thank you for commenting on our group work. Thank you very much, dear participants. We were very happy to see you today, dear colleagues. It's very valuable for us. Your active participation inspires us and gives us a lot of food for thought. And I would like to thank the PACE team that made it happen, Anastasia, Ira, Ksenia, Felix. I would also like to thank our translators, Anna Akmaeva and Anastasia Paliga. Thank you. So, colleagues, in our chat, you'll see the feedback form. Now you can see this. It would be very nice if you could save this form before exiting Zoom. We really value your feedback, and we offer just a couple of questions. It'll take you 2 or 3 minutes, but that's very helpful for us. Please, could you give us the feedback via the form? So we'll share all the materials that we discussed today. We'll organize it in a nice form. You've already got the links for our upcoming webinars, which are once again on the 20th of July and 3rd of August. And I would like to remind you that we offer newsletters that you can subscribe to via our website, paced.org.uk. And we also have group chat, and you also in our Zoom chat can see the link to our group chat, a lot of chats. So thank you, dear colleagues. Thank you for being with us today, and we are looking forward to our next meetings. Thank you.